Hello, my name is Betty Robbins, and today I will present my population-level health education intervention focused on mental health stressors and limited community support among older adults in San Diego County's Central Region. The presentation summarizes how I designed, implemented, and evaluated a community-based mental health education and support group intervention. The intervention addresses mental health stressors and limited community support among older adults in downtown San Diego, particularly those served by the Gary and Mary West Senior Wellness Center. The Central Region has a high concentration of older adults, many living on fixed incomes and relying on walking or public transportation. Mental health concerns are often under-recognized, but significantly affect quality of life, chronic disease management, and mortality. Population data and community observations identified several concerns, including high prevalence of chronic disease, social isolation and housing instability, limited access to affordable mental health services, and economic stress contributing to anxiety and depression. Social isolation increases the risk of depression, anxiety, and suicide in older adults. Community health nurses play an important role in addressing these issues through education, early identification, and community support. The target population includes older adults served by the Gary and Mary West Senior Wellness Center. Many individuals in this group have low or fixed incomes, live alone or experience housing insecurity, have diverse cultural and language backgrounds, rely on public transportation, and experience high rates of chronic disease. Regional data shows suicide is among the leading cause of death, and chronic conditions like heart disease and diabetes are common. These factors contribute to increased mental health risk and highlight the need for community-based mental health education and support. The intervention aligns with Healthy People 2030 objectives MHMD-01 and MHMD-05, which focus on reducing suicide rates, improving mental health through early identification, increasing access to care, and reducing stigma around seeking help. Many adults with depression, especially older adults, do not receive adequate treatment due to barriers such as stigma, transportation challenges, cost, and lack of awareness. Community-based education and support programs help increase awareness, encourage screening, and connect individuals with resources. Community needs were identified through several data sources, including a windshield survey of downtown San Diego, public health data from San Diego County, vital statistics related to chronic disease and suicide, observations and conversations at the Senior Wellness Center, and demographic data from census and community reports. These sources revealed common themes of loneliness, stress, and interest in group activities, supporting the need for a mental health education intervention. The priority intervention is a community-based mental health education and support group. The desired outcomes include short-term, at least 50% of participants increase knowledge of stress management and mental health resources. Medium-term, at least 30% report improved social connection and engagement. And long-term, that reduced stress, anxiety, and depression measured using tools like the PHQ-9 and the GAD-7. The program includes primary prevention through education and stigma reduction, secondary prevention through early identification and screening, and tertiary prevention through support for individuals with existing mental health conditions. Sessions are interactive using simple language and visual aids and are held at the Senior Wellness Center to create a comfortable and trusted environment. The intervention is a creative journaling and peer support group held at the Gary and Mary West Senior Wellness Center. Participants begin by creating and decorating their own personal journals, followed by guided writing prompts focused on reflection, gratitude, coping strategies, and positive memories. After journaling, participants join small peer discussion groups where they can share experiences and connect with others. These discussions help reduce social isolation and strengthen community support. The program supports Healthy People 2030 goals by promoting emotional expression, improving mental health awareness, and encouraging individuals to seek help when needed. The intervention combines creative journaling with peer discussion groups. Journaling provides a structured way for participants to reflect on their own thoughts and emotions, while group discussion allows them to share experiences and build connections. The main goals are to reduce social isolation, encourage open conversation, and strengthen support relationships among older adults in the community. The intervention will be evaluated at multiple levels. Immediate outcomes will be measured using pre- and post-session surveys to assess knowledge of stress management techniques and awareness of community resources. Participants will also be tracked through attendance and engagement in activities. Long-term outcomes will be evaluated using screening tools such as the PHQ-9 and GAD-7, along with observations of increased social interaction and continued participation in community activities. Sustained collaboration and community-based education are essential for improving long-term mental health outcomes for older adults. A single educational session cannot fully address these needs, so ongoing partnerships with community organizations, healthcare providers, and social service agencies are important. Key collaborators include staff at the Gary and Mary West Senior Wellness Center, along with community nurses, behavioral health professionals, social workers, and local nonprofits serving older adults. Two strategies can help sustain this initiative. First, the Senior Center could continue offering regular art and journaling groups, which encourage self-expression, emotional reflection, and stress reduction. Second, ongoing peer discussion groups can provide a supportive space for older adults to share experiences, build relationships, and reduce social isolation. Community and public health nurses play an important role in advocating for programs that promote mental health well-being and strengthen social support networks. Through continued partnerships and community-based programming, we can help improve mental health outcomes and quality of life for older adults. By addressing mental health through education, early identification, and community support, public and community health nurses can improve quality of life and reduce health disparities among older adults in downtown San Diego.